You think you're clean, but what if I told you that your hygiene habits might be slowly betraying you without you ever realizing? I've seen it as a doctor far too many times. People who look immaculate on the outside, but are silently accumulating damage due to simple, overlooked mistakes. And these aren't extreme cases. We're talking about things you might be doing every single day. Keep watching, because I promise, by the end of this video, you'll know exactly how to spot and fix these red flags. And trust me, your future self will thank you. Let's begin with a patient I once had. Let's call her Sarah. She was a corporate professional in her early 30s. Smart, driven, and health conscious, or so she thought. She came in complaining of itchy ears and persistent irritation, but otherwise she believed she was maintaining excellent hygiene. We began to unpack her daily routine, and quickly the problem became clear. Cotton swabs. Cotton swabs were her go-to tool every morning. It was a habit her mother taught her as a child. She'd twist and prod until her ears felt dry and clean. But what Sarah didn't realize is that the inner ear is self-cleaning. Using cotton swabs pushes wax deeper inside, risking impaction and even injury. More than 70% of minor ear canal abrasions we see in clinics are due to these swabs. Once Sarah switched to gently cleaning only the outer ear with a warm cloth, her symptoms faded. That simple shift changed her mornings forever. Another subtle yet powerful hygiene mistake revolves around bath towels. Sarah reused her bath towel for nearly a week, because let's be honest, it seems like a harmless habit. She'd hang it neatly to dry, assuming it was clean enough. But under a microscope, that towel was a microbial jungle. Bacteria thrive in damp, warm environments. If you're using the same towel repeatedly, especially on your face, you're inviting acne, rashes, and even fungal infections. I advised her to use a fresh towel every 2 to 3 days and a separate one for her face. A month later, her facial inflammation cleared. Now let's visit the oral cavity, an area people tend to overestimate. Sarah brushed twice a day. She flossed. She even used mouthwash. But one crucial part was missing: her tongue. The tongue is often a neglected surface. That white film that builds up overnight, it's not just leftover food, it's bacteria, dead cells, and toxins. When left unchecked, it can cause bad breath, impact taste, and lead to oral infections. I handed Sarah a simple plastic tongue scraper. The very next day, she texted me, "Coffee has never tasted this good." Feet are another hygiene battlefield that few consider. Sarah exercised regularly. She wore sneakers almost daily, rotating between only 2 pairs. The foot odor and occasional itching she experienced, that wasn't due to her feet, it was due to poor shoe hygiene. Shoes trap moisture. Inside that warm, dark environment, fungi flourish. I taught her the 3-shoe rule. Rotate your shoes, never wear the same pair 2 days in a row, and use cedar shoe inserts overnight. Insoles, wash them once a week. Her foot problems disappeared within weeks. Then came the surprise: fingernails. She kept them neat and short, but never cleaned under them unless visibly dirty. That's a major oversight. The area beneath the nails is one of the most bacteria-dense spots on our hands. From touching your phone, typing, handling food, or rubbing your eyes, your nails are constantly involved. I gave her a tiny nail brush and showed her how to use it during hand washing. Within 2 weeks, her recurring eye irritation and minor facial breakouts stopped. Lastly, the most intimate and often ignored hygiene mistake: nighttime underwear. Sarah slept in clean cotton underwear every night. Seems fine, right? But here's what most people miss. Sleep is when your body cools down and regulates moisture. Constrictive clothing in sensitive areas at night can cause pH imbalance, increased risk of yeast infections, and general discomfort. I recommended breathable pajama pants or going commando at night. She was skeptical but tried it. 1 month later, no more morning irritation, improved sleep quality, and even reduced sweating. What's fascinating is how each of these changes had compounding effects. Sarah wasn't just solving symptoms, she was optimizing her entire well-being. Her skin glowed more. She was less irritated. Her self-esteem even lifted. Hygiene, after all, is not just cleanliness. It's how we respect the vessel we live in. So let me break it down. Not as a list, but as a new narrative for your body. When you clean your ears gently instead of poking and prodding, you're allowing one of your most sensitive organs to protect itself as it was designed to do. When you stop reusing towels that are secretly harboring layers of bacteria, you're honoring your skin with a fresh start each day. When you scrape your tongue, you're not just eliminating bacteria, you're inviting freshness into your first breath of the day. When you care for your shoes like an extension of your hygiene, you're cutting off infections at their root. When you clean beneath your nails, you're protecting every other surface your fingers touch. Your face, your food, your loved ones. And when you sleep without constriction, you're giving your body the space to breathe, reset, and heal. This isn't a routine. This is a ritual, one based on awareness, love, and science. In my practice, I've met countless people like Sarah, professionals, students, parents, all unaware of these silent saboteurs, not because they didn't care, but because no one ever told them. Our hygiene education stops at brush your teeth and wash your hands. But true hygiene is an orchestra of small practices playing in harmony, and it begins with intention. You don't need expensive tools. You don't need 12-step skincare routines. You need mindfulness, consistency, and a willingness to question the habits you've carried since childhood. Sarah changed her life with 6 tiny shifts. So can you. Look in the mirror today, not just to check your face, but to listen. Your body is whispering what it needs. You just have to hear it. And if this video has sparked even one aha moment, then it's done its job. You're not just watching for tips. You're here because you want to be better. For your skin, your health, your future. And that's something to celebrate. Thank you for watching till the end. Your body is already thanking you for it. Now go. Reclaim your hygiene. Redefine your self-respect. Because when your doctor whispers the truth, let it echo into action.